Health is like, I don't know, the most important thing to you because that's how you keep alive.
Sometimes
you need to build up on that health, make sure you're really healthy.
And they get peer pressure.
And if you don't keep yourself healthy.
When children are aged ill, that's
some
what I
people
think
want
about.
to be skinny.
When people are
Some
my family's ill,
stop it to get medication. So that's why the health services are important, so they can help them.
Event, we just thought that health was actually a part of, mental health is a big part of Alice's campaign, actually, the current NYP. So we thought a whole health day is good because we like to get the opinions of young people in this kind of thing, and we did recently send out the survey to all young people to fill in, and I think health and mental health came up quite high on there because, you know, maybe there's a lack in the system and we're just trying to get a good voice through because that's our job as youth cabinet. I think staying healthy is important for all people. I mean, but for young people it's the best opportunity because not like we have loads of free time, but we do have time in our day that we could fill with, you know, being healthy. And health isn't just, you know, eating carrots and going for a jog. It's generally keeping yourself as a good person in health, you know, in body and mind really. The mental health, again, it's habits you carry on into being older, plus, you know, it's important to be happy, which is what health is all about.
When people go into the doctors, they're waiting for hours because there's one person, you're there, say you was at 4 o'clock, say your appointment was at 4 o'clock, you'd be in there at like 6 because there's not enough members of staff to help you, so I'd get more members of staff and qualify them so they get the appointment on time, so they're not waiting for hours to just have one appointment.
For like hospitals, I would make the waiting times like quicker because I was in hospital a year ago with a fractured arm and I had to wait like 2-3 hours just to get like a cast on my arm. And if it was like a proper emergency and people had to wait that long, people could die because of that. And like doctors and like pharmacies should be open later because when we come back from school, like if for example the doctors were open 8 till 5, we only have, and if you had an appointment after school, depending where you live, you could only like get only have like 10 minutes for your appointment, and you could end up missing like you could end up missing the appointment, and then if you're seriously ill, it could like affect you.
A cure to cancer would be a nice thing because there are lots of people, and there's a young girl called Lily, I think it is, and another one called Jack, and they've both got cancer for being young, and I'd probably change it so that there is a lot more funding to like illnesses like that, and there's a big Ebola threat, I was thinking, that's been going around as well, and it'd be good to try and find a way to stop that as well.
I would get bigger health practice so more patients could be, more children could be treated, say if they got Ebola or something, and say if they got cancer, I'd have a special, I'd like be running a few hospitals for just for cancer people, because sometimes cancer people, there's not enough staff in a hospital sometimes to help everyone, and people die because they're not getting given treatment, and I'll make sure there's the right amount of staff.
Give the doctors better listening skills. Let them listen to a patient first before doing anything out of the ordinary, like sending them away or refusing them. And quit with the very, very long appointments. Let them be seen when they want to be seen. Don't let the appointment be dragged out a few days later or so, because the problem could get worse then.
I think I'd change the accessibility at times at night, because I think that's a big part of when young people are vulnerable. Because I think a lot does happen behind closed doors at night, because during the day you're at school and you're away from home and different things like that. So I think it's more the night I'd change the accessibility.
I'd change the time, like the waiting times in the hospitals and doctors. I'd make sure that top doctors know what they're doing, make sure they're looked after, and make sure they feel like welcome, that they're not uncomfortable.
I want to see more staff, and I want to improve the less waiting time. And the less waiting time, not more, because you can wait like hours and hours because there's less staff and there's loads of people in there. And because there's less staff, we need more staff, so there's less waiting time.
I think that some of the people are like the doctors are not really they're not spending enough time with the patients, and because if that patient wants to like talk to the doctor to get something out or something, like if they want to say something to the doctor that they feel a bit uncomfortable about, the doctors don't really give them much time to talk to them. They just they think that they're not much important. They need to go to different patients, and it's not right.
You don't get, say like if you need to stay in overnight, you sometimes don't get the treatment you need, and like Kyle said, they're not looking after you as much.
I think they need like more research on, let's say it like cures for like young children, so it's suitable for them. And yeah, like the waiting times, they need to be quicker, because like it needs to be like quick, because they're much younger, so they're more weaker than adults, and they're more likely to like get more ill. And I don't know. Like, they need to get seen quick, and I think they need just like more. When they're treating children, doctors they just need more like comfort and support in doctors.